We've talked about the drug development process, and the time, resources, and money involved are staggering. So is it all worth it? Well, think about the medicines that you, your family, and friends take, and I think you'll agree with me, the answer is yes. It's worth all of that to have these innovations. What we're going to do in this module is to talk about some of those innovations that have come about because of the drug development process. I will be giving you some facts and figures, but you'll also be hearing about some personal stories, how drug innovations have changed people's lives for the better. So there are a variety of new treatments out there because of the sorts of research and development that's being conducted every day in the pharmaceutical industry. These innovations have worked to improve patients' health by saving and improving lives. And as we highlight some of these innovations, you're going to understand the importance of the breadth of R&D focus and the array of new treatments that have resulted from the research and development activities. It takes decades of investment to produce medicines that treat and prevent disease. You've seen all this. You're going to hear more about it over the duration of this course. But when you look at some of the examples of medicines that have resulted and have improved health outcomes, you'll see that there's a far-reaching implication for innovation. We're going to talk a little bit about cancer innovations as an example of what has happened over the past several years and why these innovations are so important to have produced the types of treatment options that are now available. There's been substantial progress in terms of oncology innovations that help fight cancer, and the cancer death rates continue to fall. They've started falling for the first time since the 1990s, and in the United States, the National Cancer Institute has reported a 20% decline in cancer deaths since 1991. And this is much in part to better testing, better diagnostics, and better drug products. So these improved statistics and health outcomes result from the introduction of new therapies and improved treatment regimens. Some of these treatments are in solo, just a single drug product. Others are in combination. They've done testing to find what mixture of drug products can best help, especially in treating a cancer. Because cancer is complex, and it's hard to understand exactly how to treat it in the best way without doing all of these clinical trials. And once you do that, you can understand the best approach and how a patient can benefit over time from using these new approaches. So when treatment options are lacking, FDA, when it comes to cancer products, goes a little bit different way. They may actually approve a cancer treatment based on what we call a surrogate endpoint, as opposed to a full, robust clinical trial prior to the long-term studies being completed. So an example of a surrogate endpoint would be, has this drug reduced the size of a tumor, as opposed to looking at the longer-term clinical outcome. An example of this was the FDA's approval of Gleevec in 2001 for the treatment of chronic myeloid leukemia, or CML. And they saw that patients responded at the cellular level, and it was approved in 2001. And in 2007, when they completed the full clinical studies, they saw and were able to confirm the clinical benefit. And in fact, what they saw was an 88% survival rate versus the previous 48% survival rate prior to the introduction of Gleevec. But sometimes additional testing is performed to actually expand the use of current therapies. An example of this is docetaxel, or Taxotere. Initially, Taxotere was a second-line treatment for metastatic non-small cell lung cancer, and that was in 1999. And it demonstrated that it improved the health outcome, and it was moved up to a first-line treatment for non-small cell lung cancer in 2002. Similarly, Herceptin was initially approved by FDA in 1998 for metastatic breast cancer patients whose tumors express the HER2 protein. In 2010, it received an additional indication for metastatic gastro or gastroesophageal junction adenocarcinomas expressing the HER2 protein as well. And again, in 2006, it was approved for the post-op breast cancer treatment when used in combination with other treatments. So this is an example of you may have started with one indication and it moves along to additional indications. 340 medicines were approved by FDA in the last 10 years. And as a result of this research, some of the more recent advances in 2011, those approvals resulted in 2 new cancer medications for lung and melanoma cancers for patients with tumors expressing genetic markers. This is very important because we'll be talking about personalized medicine, and this in fact is part of the advent of personalized medical options. Also in 2011, for hepatitis C, there were 2 new medications that were first in class, in a new class, and offer a greater chance for a cure. Also in 2011, there were advances in lupus, the first new medicine since 1955. Yes, you heard me right, 1955 was approved, using a new approach to this very serious autoimmune disease. So outside of cancer, let's look at a few other of the therapeutic areas and how innovations have impacted, healthcare. Cardiovascular disease fell almost 30% between 1997 and 2007, in large part due to the improved treatment options that are available. Diabetes, there was an explosion of 8 new classes of medicines that provide better outcomes, extend life, and the patients suffer fewer complications. And for HIV/AIDS, the death rate in the U.S. has fallen by 83% since 1995 with the development of the highly active antiretroviral therapy, which is a combination of medicines. And again, cancer, the 5-year survival rates for the 70s, in the 1970s was 49%, and in 2007, the survival rate 67%. So these new medical innovations are resulting in better quality of life, better health outcomes for patients. So in the slides that I'm showing you now, I'm going to very quickly go through some of the great moments in innovations in the last 20 years. I will highlight some of these. There is additional information that can be found online if you are interested, because I will be going through these quickly. In the early 1990s, a new treatment for schizophrenia was introduced after 22 years in development. And what was exciting about it is that it was more effective and had fewer side effects than any of the other treatments that were available prior to that time. In addition, there were 2 new drugs to ease chemotherapy side effects, which is huge. I mean, these chemotherapeutic agents are doing wonderful things, but they traditionally have very uncomfortable side effects, such as nausea. And 2 new drugs were introduced in the early 90s to help with that. In addition, in the early 90s, you saw treatments for Alzheimer's being introduced to boost memory and mental functioning. Progressing into the mid-90s, you saw paclitaxel, we mentioned Taxotere before, which was first approved for breast cancer as it inhibited tumor growth. And in 1996, the FDA approved ivermectin to treat river blindness, which is caused by a parasitic worm. But what you might not know is that it threatens 85 million people in Africa and Latin America. And what they were able to develop is a single annual dose. And that one single annual dose could have the impact up to 85 million people. So that is tremendously significant. In the late 90s, 1997, the FDA approved rituximab, a biotech cancer treatment for non-Hodgkin's lymphoma. And there is also breakthroughs in arthritis medications that help millions to reduce the pain and constant anguish, associated with arthritis. And in the early 2000s, probably the most significant event to happen that has continual impact on drug innovations was the mapping of the human genome. That is spurring on a number of new innovations, technologies, and strategies to both diagnose and treat diseases. And in 2004, you saw the first treatment for metastatic cancer, an angiogenesis inhibitor that was first used in colorectal cancer. And in the past few years, we've seen just a plethora of new drug products. The first vaccine to prevent cancer, and that's the human papillomavirus. New HIV medications, the integrase inhibitors that slow the progress of the HIV infection. And then we saw the first medicine for the treatment of the jerky involuntary movements that are associated with Huntington's disease. There was the first immunotherapy for cancer treatments that individually tailored to prostate cancer patients, and 2 new medicines for multiple sclerosis, improving the quality of life and the ability to walk. So you can see that there have been, and these are just a few of the innovations that have come along in the past 20 years. And there is much more being done in terms of being able to diagnose and treat and develop new products for the diseases that many of us may be suffering from and previously could not be treated. So there are a number of new drugs, there are new strategies that are having a positive impact on patients. Better quality of life, extending life, making it easier to go about, your daily routine. We are seeing that these medicines are making a difference, and that's why understanding how drugs are developed and the impact that they're having, that's the first step in becoming an informed consumer. And we're hoping that by understanding these important facts, that you will be able to take your medicine in a way that, number one, you understand what you're taking, but number two, you appreciate what has gone into the development and the approval of these drug products to make them available to you.